Hey, you guys! It's me, Kess. I'm back. I just wanted to read you guys my pamphlets about the disease or the poisons they're giving me. So, the cancer or chemo, I still have chemo brain. Bear with me through all this. The chemo itself is 4 different kinds of poisons, as far as I understand. This one, rituximab, sure. Doxorubicin, probably. Vincristine, and then this adiposide or adiposin, whatever it is. All of those. I was just reading through them and I thought you guys would enjoy these informational pamphlets. So let's start with the rituximab. May cause serious brain infection that can lead to disability or death. Tell your doctor if you have hepatitis B, because the condition can get worse. Severe skin problems. Obviously, tell your doctor if you have lightheadedness, blah, blah, blah. May cause rare disorders that cause inflammation of blood vessels and other tissues. It's obviously used to treat non-Hodgkin's lymphoma and lymphocytic leukemia. Tell your doctor if you have kidney disease, hepatitis, longer breathing disorder, a weak immune system, herpes, shingles, chickenpox, West Nile virus, hepatitis B or C. I think it's ironic that they're like listing all this stuff out and they're like, oh, let them know if you have trouble breathing. And then I'm like, okay, well, I do have trouble breathing, but because of the tumor. And they're like, don't take if you have a weakened immune system. And I'm like, but I do have a weakened immune system because of this. So I don't really understand, but I'm not the doctor. These are all given through an IV. It's kind of cool because these little pamphlets have what happens if I miss a dose and what happens if I overdose. So that's useful for like more outpatient stuff. Obviously, all my cancer stuff is going to be inpatient, but side effects includes hive, chest tightness, swelling, dizziness, weak, lightheadedness, short of breath. Pages and pages. Let them know if you have fevers, chills, dark urine, irregular heartbeats. All that good stuff about rituximab. Number 1. Number 2, adiposide. This affects cancer growth. Good. It's funny because it says this one is used to treat cancer of the lung or testicles. Very similar. I do enjoy that. I also love, on all of these, it says do not use if you are allergic to it. Like, I'm sure we've all seen those stupid medicine commercials and like, oh, don't use if you're allergic to it. I'm like, well, duh. Everyone knows that. And like, obviously you're not going to know until you take it. But like, I just feel like that's something that you shouldn't have to say. But I guess nowadays you have to say it. So this one is part of a 4 or 5 day treatment cycle every 3 or 4 weeks, which is the one I'm on. Adiposide can be harmful if it gets on your skin. If skin contact occurs, wash area with soap. One of these talks about calling the poison control center, so we'll get there. Your blood will need to be tested often. It can lower blood cells that help your body fight infections and help your blood to clot, which again is weird because I'm taking all these blood thinners. So it's like, do I need to take the blood thinners if all of these are thinning my blood and like helping my blood? Again, I don't know. I just do what they tell me. Oh, this is cool. Do not receive a live vaccine, which it says like live vaccines include measles, mumps, rubella, rotavirus, typhoid, yellow fever, varicella, zoster, which is shingles, and the nasal flu, influenza vaccine. So I thought that was kind of interesting, which, I mean, makes sense because I can't fight bacteria or anything. So that's kind of cool to think about. This medicine can pass into body fluids such as urine, feces, or vomit for at least 48 hours after you receive a dose. Avoid allowing your body fluids to come in contact with your hands or other surfaces. Caregivers should wear rubber gloves while cleaning up, blah, blah. So this is where the Lysol wipes come in handy, and I have to have my own bathroom because I could poison/burn my roommates. So that's awesome. Possible side effects: fevers, aches, chills, easy bruising, pale skin, stomach pain, loss of appetite, itching, seizures, severe skin reaction, sore throat, swelling, blistering, peeling, nausea, vomiting, stomach pain, loss of appetite, diarrhea, constipation. I love that those two are always together because, like, super opposite. Like, again, it makes sense, but diarrhea or constipation. Good luck finding out which. Temporary hair loss, unusual or unpleasant taste in your mouth. Yay! Oh, and then it always says, what other drugs will affect this medication? And this one talks about blood thinner. So, not sure if I'm supposed to be on blood thinner, if this thins my blood. It's confusing. But, again, that's why I don't have it. Or why I'm not the doctor. Third one, vincristine. Medication that interferes with the growth of cancer cells. This one is leukemia, Hodgkin's disease, non-Hodgkin's lymphoma, which is what I have. Rhabdomyosarcoma, soft tissue tumors, neuroblastoma, cancers that form in nerve tissue, and Wilms tumor. And then it talks about, tell your doctor if you have liver disease, breathing problem, epilepsy, bacterial infection, blah, blah, blah. Do not use if you're pregnant. All that stuff given through an IV. What to avoid. Sick people, again, can pass through body fluids for at least 48 hours. Avoid everything. Side effects, wheezing, chest tightness, fever, chills, problems with vision, hearing, speech, swallowing, tingly feeling, numbness, severe constipation, severe bloating or stomach pain, temporary hair loss, decreased weight, and loss of muscle tissue, diarrhea, nausea, vomiting, loss of appetite, or weight loss. This one's pretty straightforward. Again, they're all just great things. Fourth one, doxorubicin. Do not use if you are allergic. Or if you have liver disease, heart problems, had a heart attack, kidney disease, bone marrow. Oh, a bone marrow suppression too, because bone marrow is where you make the blood cells and like white blood cells and all that to fight infection. So it's like they're suppressing your immune system, but does that count as bone marrow suppression? Because I don't know if it's like the bone marrow itself or just like the stuff that comes out of it, and that's kind of confusing to me, but whatever. This one I thought was interesting. Obviously don't use if you're pregnant, but it says use birth control to prevent pregnancy while you're using this medicine, whether you're a man or a woman. Women obviously avoid pregnancy for this medication for at least 12 months after your last dose. I'm having this weird like, oh my god, I can't have a kid for a year after all of this. And then I'm like, I'm so young, I don't need to worry about that. But just like seeing it on a piece of paper, like I can't fly in an airplane for like a year. I'm just like, what about all these trips I want to take? What if I want to take a trip? I don't even know. So I'm having that weird thing. But anyways, if you are a man, use effective birth control if your sexual partner is able to get pregnant. An unborn baby can be harmed if a man fathers a child while he is using doxorubicin. So I thought that was kind of interesting. Obviously, it's poisoning everything and everything's just wrecked, but this one specifies men and women. It may affect your fertility, whether you are a man or a woman. Obviously, breast milk should not be breastfeeding, blah, blah, blah. What happens if I miss a dose? What happens if I overdose? Some of these are cool because it says, since this medication is given by a healthcare professional in a medical setting, an overdose is unlikely to occur. So I'm like, well, that's so nice. That makes you feel good. I trust them. Side effects. Pain, blisters, skin sores, missed menstrual periods, easy bruising, unusual bleeding, purple or red pinpoint spots, low blood cell counts, fever, swollen gums, painful mouth sores, pain when swallowing, skin sores, cold or flu symptoms, signs of heart problems. Don't know what that means. It says fast heartbeat, shortness of breath, swelling in your ankles or feet. So heart disease, cancer medication, who knows? This is all definitely a interesting combination. So those are my 4 chemo medications, and then this is my post-chemo. This one, really long, high-tech word. Let's see if we can do it. Cyclophosphamide. High-tech. Cyclophosphamide is a cancer medication that interferes with the growth and spread of cancer cells in the body. How useful! Used in certain types of kidney disease, which is interesting. Let your doctor know if you have had an active or recent infection, weak immune system, heart disease, kidney disease, liver disease, receiving other cancer treatments, which guess who's receiving other cancer treatments? If you've ever had radiation, which I haven't, so that's good. Oh, this is my favorite. Using cyclophosphamide may increase your risk of developing other types of cancer, such as bladder cancer. So they're going to take my cancer and maybe give me more cancer. So that'll be fun. But obviously they talked to me about it and they said, oh, this is the best option for you right now. Like, let's not really worry about the future. Let's get you healthy right now. And I'm like, can we just like avoid all of this? Can we just not do that? I don't want bladder cancer. Like, lymphoma is bad enough, but let's just tack another one on there. Who cares? Get them all. Again, do not use if you're pregnant. It may affect fertility, breast milk, blah, blah, blah. Miss a dose, overdose. What should I avoid? Oh, this is just about bathroom stuff again. I don't know why it doesn't focus. Focus on me. Hello. There it is. Again, do not receive a live vaccine. Kind of cool. Can't get any flu vaccines. See, it also says, do not receive a live vaccine, and at least for 3 months after your treatment ends. So I got a flu shot like a couple months ago. So I guess I was before my treatment, but I don't know. Whatever. Too late now. Call your doctor if you have blood in your stool, pain and burning when you urinate, pale skin, lightheaded, rapid heart rate, trouble concentrating. Wait. Fevers, chills, body aches, flu symptoms, sores in your throat, easy bruising, unusual bleeding, red or purple pinpoints, extreme thirst, headache, vomiting, weakness, jaundice, severe skin reaction, fever, sore throat, swelling in your face or tongue, burning in your eyes, skin pain. Common side effects: nausea, loss of appetite, temporary hair loss, a wound that will not heal, missed menstrual periods, changes in skin or color, changes in nails, whatever that means. So, these are my lovely pieces of poison. I just wanted to update you guys on what's going on. I'll see you guys next time.